Coronavirus Diseases 2019 COVID-19 Situation Summary from CDC Center for Disease Control and Prevention.
Welcome to Jocelyn's Stein vlog. Please don't forget to subscribe, like, and share. Make sure to hit the bell notification button to keep you posted. Love you guys. Thank you.
Okay, CDC Center for Disease Control and Prevention. CDC 24/7, saving lives, protecting what? Protecting people. Okay, coronavirus diseases 2019 COVID-19. Okay, about coronavirus diseases 2019 COVID-19. There is an ongoing investigation to determine more about this outbreak. This is a rapidly evolving situation, and information will be updated as it becomes available. Latest updates on this outbreak. How it spread. COVID-19, how COVID-19 spreads. COVID-19 is a new disease and we are still learning how it spread, the severity of illness it causes, and to what extent it may spread in the United States. How COVID-19 spreads, person to person spread. The virus is thought to spread mainly from person to person between people who are in close contact with one another within about 6 feet through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Okay. Can someone spread the virus without being sick? People are thought to be most contagious when they are most symptomatic, the sickest. Some spread might be possible before people show symptoms. There have been reports of this occurring with this new coronavirus, but this is not thought to be the main way the virus spread. Spread from contact with infected surfaces or objects. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus spread. Okay? How easily the virus spread? How easily a virus spreads from person to person can vary. Some viruses are highly contagious, spread easily like measles, while other viruses do not spread as easily. Another factor is whether the spread is sustained, spreading continually without stopping. The virus that causes COVID-19 seems to be spreading easily and sustainably in the community spread in some affected geographic areas. Community spread means people have been infected with the virus in an area, including some who are not sure how or where they become infected. Well, this will come to maybe the only thing that people touch most of the time are the money from one person to another. So no need of a contact to that because when you touch the money, you get it. Okay? So situation in the US. Imported cases of COVID-19 in travelers have been detected in the US. Person-to-person spread of COVID-19 was first reported among close contacts of returned travelers from Wuhan. During the week of February 23rd, CDC reported community spread of the virus that causes COVID-19 in California in two places, Oregon and Washington. Community on Washington. Community spread in Washington resulted in the first death in United States from COVID-19, as well as the first reported case of COVID-19 in a healthcare worker and the first potential outbreak in a long-term care facility. Okay, let me go to this. Coronavirus disease COVID-19 situation summary. This is an emerging, rapidly evolving situation, and CDC will provide updated information as it becomes available, in addition to updated guidance. Updated March 6, 2020. Background. CDC is responding to an outbreak of respiratory diseases caused by a novel new coronavirus that was first detected in China and which has now detected in almost 90 locations internationally, including in the United States. The virus has been named SARS-CoV, SARS-CoV-2, and the disease it causes has been named coronavirus disease 2019, abbreviated COVID-19. Okay, SARS-CoV and the disease has been named coronavirus disease 29, abbreviated COVID-19. Okay, on January 30, 2020, the International Health Regulation Emergency Committee of the World Health Organization declared the outbreak a public health emergency of international concern. PHEIC. On January 31st, 2020, Health and Human Services Secretary Alex M. Azar II declared a public health emergency (PHA) for the United States to aid the nation's healthcare community in responding to COVID-19. Source and spread of virus. Coronavirus are largely family of viruses that are common in people and many different species of animals, including camels, cattle, cats, and bats. Rarely animals, coronavirus can infect people and then spread between people, such as with MERS, SARS-CoV, SARS-CoV, and now with this new virus named SARS-CoV-2. The SARS-CoV-2 virus is a beta coronavirus like MERS, SARS-CoV, and SARS-CoV. All three of these viruses have their origins in bats. The sequences from U.S. patients are similar to the one that China initially posted, suggesting a like single recently emergence of this virus from the animal reservoir. Early on, many of the patients at the epicenter of the outbreak in Wuhan, Hubei province, China, had some link to a large seafood and live animal market, suggesting animal-to-person spread. Later, growing a number of patients reportedly outside Hubei and in countries outside China, including in the United States. Okay. Hubei and in countries outside China, including the United States, some international destinations now have apparent community spread with the virus that caused COVID-19, as do some parts of the United States. Community spread means some people have been infected and it is not known how or where they become exposed. Learn what is known about the spread of this newly emerged coronavirus situation. In addition to CDC, many public health laboratories are now testing for the virus that causes COVID-19. View CDC Public. Okay, with this increase in testing, now 19 states have reported cases of COVID-19 to CDC View. Latest case count, deaths, and map of states with reported cases. U.S. COVID-19 cases include imported cases in travelers, among those contracts of a known case, community acquired cases where the source of the infection is unknown. Illness severity.
The complete clinical picture with regards to COVID-19 is not fully known. Reported illnesses have ranged from mild, including some with no reported symptoms, to severe, including illness resulting in deaths. While information so far suggests that most COVID-19 illness is mild, out of China suggesting a report out of China suggests serious illness occurs in 16% of cases, older people and people of all ages with severe underlying health conditions. Like health diseases like heart disease, lung disease, and diabetes, for example, seem to be at higher risk of developing serious COVID-19 illnesses. Okay, higher risk of COVID-19 serious illnesses. Okay, so risk assessment. Okay, learn. There are ongoing investigations to learn more. This is the rapidly risk of assessment. Outbreaks of novel virus infecting among people are always of public health concern. The risk, the risk, the risk to the general public from this outbreak depends on characteristics of the virus, including how will spread between people, the severity of resulting illness, and the medical or other measures available to control the impact of the virus, for example, vaccines or medication that can treat the illness. That this disease has caused severe illness, including illness resulting in death, is concerning, especially since it has also known sustained people to person spread in several places. These factors meet two of the criteria of a pandemic. As community spread is detected in more and more countries, the world moves closer toward meeting the third criteria, worldwide spread of the new virus. Okay, it is important to note that current circumstances suggest it's likely that this virus will cause a pandemic. This is a rapidly evolving situation, and CDC's risk assessment will be updated as needed. Current risk assessment. For most people, the immediate risk of being exposed to the virus that caused COVID-19 is thought to be low. This virus is not currently widespread in the United States. Okay, that's current risk assessment. People in places where ongoing community spread of the virus that causes COVID-19 has been reported are at elevated risk of exposure, with increase in risk dependent on the location. Healthcare workers caring for patients with COVID-19 are at elevated risk of exposure. Close contact of persons with COVID-19 also are at elevated risk of exposure. Travelers returning from affected international locations where community spread is occurring also are elevated risk of exposure, with increase in risk dependent on the location. CDC has developed guidance to help in risk assessment and management of people with potential exposure to COVID-19. What may happen? More cases of COVID-19 are likely to be identified in the coming days, including more cases in the United States. It's also likely that sustained person-to-person spread will continue to occur, including throughout communities in the United States. It's likely that at some point, widespread transmission of COVID-19 in the United States will occur. Widespread transmission of COVID-19 would translate into large numbers of people needing medical care at the same time. Schools, children's centers, and workplaces may experience more absenteeism. Mass gathering may be sparsely attended or postponed. Public health and healthcare system may become overloaded. With elevated rates of hospitalization and deaths, other critical infrastructure such as law enforcement, emergency medical center, and sectors of the transportation industry may also be affected. Healthcare providers and hospitals may be overwhelmed. At this time, there is no vaccine to protect against COVID-19 and no medications approved to treat it. Non-pharmaceutical interventions would be the most important response strategy. CDC Response. Okay, global efforts at this time are focused concurrently on containing the spread of mitigating the impact of this virus. This federal government is working closely with state, local, tribal, and territorial partners, as well as public health partners to respond to this public health threat. The public health response is multi-layered with the goal of detecting and minimizing introduction of this virus in the United States. CDC is implementing all of its pandemic preparedness and response plans, working on multiple fronts to meet these goals, including specific measures to prepare communities to respond to local transmission of the virus that caused COVID-19. There is an abundance of pandemic guidance development in anticipation of an influenza pandemic that is being adapted for a potential COVID-19 pandemic. Highlights of CDC response. CDC established a COVID-19 incident management system of January 7, 2020. On January 21st, CDC activated its Emergency Operations Center to better provide ongoing support to the COVID-19 response. The U.S. government has taken unprecedented steps with respect to travel in response to the growing public health threat posed by this new coronavirus. On February 2, the U.S. government suspended entry of foreign nationals who have been in China within the past 14 days. U.S. citizens, residents, and their immediate family members who have been in Hubei province and other parts of mainland China are allowed to enter the United States, but they are subject to health monitoring and possible quarantine for up to 14 days. On February 29, the U.S. government announced it was suspending entry of foreign nationals who have been in Iran within the past 14 days. CDC has issued the following travel guidance related to COVID-19. CDC has issued clinical guidance including on January 30, CDC published guidance for healthcare professionals on the clinical care of COVID-19 patients. On February 3, CDC posted guidance for assisting the potential risk for various exposures to COVID-19 and managing those people appropriately. On February 27, CDC updated its criteria to guide evaluation of persons under investigation for COVID-19. On February 28, CDC issued Health Alert Network HCN updated an interim guidance on outbreak of COVID-19. CDC has deployed multidisciplinary teams to support state health department case identification, contact tracing, clinical management, and public communication. CDC has worked Department of State supporting the safe return of Americans who have been stranded as a result of the ongoing outbreaks of COVID-19 and related travel restrictions. CDC has worked to assist the health and passengers as they return to the United States and provided continued daily monitoring of people who are quarantined. An important part of CDC role during the public. This is the picture of CDC laboratory test kit for severe acute respiratory syndrome. An important part of CDC role during the public health emergency is to develop a test for the pathogen and equip state and local public health labs with testing capacity. After distribution of a CDC RRT, the PER test to diagnose COVID-19 to state and local public health labs started performance issues were identified related to a problem in the manufacturing of one of the reagents. Laboratories were not able to verify the test performance. CDC worked on two potential resolutions to this problem. CDC developed a new protocol that uses two of the three components of the original CDC test kit to detect the virus that causes COVID-19 after establishing that the third component, which was the problem with the original test, can be excluded from testing without affecting accuracy. CDC is working with FDA to amend the existing emergency use authorization EUA for the test. But in the meantime, FDA granted discretionary authority to the use of the original test kits. Public health laboratories can use the original CDC test kit to test for the virus that causes COVID-19 using the new protocol. Further, newly manufactured kits have been provided to the International Reagent Resource for distribution to state and local public health labs. Combined with other reagents that CDC has produced, there are enough. Okay. This picture of CDC laboratory kit of severe acute respiratory syndrome coronavirus 2 SARS-CoV CDC is shipping the kit. The test kits to laboratory CDC has designed as equipped, including U.S. state and local public health laboratories, Department of Defense (DoD) laboratories, Department of Defense laboratories, and select international laboratories. The test kits are bolstering global laboratory capacity for this detecting SARS-CoV-2. Okay. Public health laboratories use the original CDC kit. Okay, for distribution to the state and local public health, combined other reagents that CDC has procured that are enough testing kits to test more than 75,000 people. In addition, CDC has two laboratories conducting testing for the virus that causes COVID-19. CDC can test approximately 350 specimens per day. Commercial labs are working to develop their own tests that hopefully will be available soon. This will allow a greater number of tests to happen close to where potential cases are. CDC has grown the COVID-19 virus in cell culture, which is necessary for further studies, including for additional genetic characterization. The cell-grown virus was sent to NIH BEI Resources Repository for use by the broad scientific community. CDC recommends everyone can do their part to help us respond to this emerging public health threat. It's currently flu and respiratory disease season, and CDC recommends getting a flu vaccine, taking everyday preventive action to help stop the spread of germs, and taking flu antivirals if prescribed. Individuals and communities should familiarize themselves with recommendations to protect themselves and their community from getting and spreading respiratory illnesses like coronavirus disease 2019. Older people and people with severe chronic conditions should take special precaution because they are at higher risk of developing serious COVID-19. If you are a healthcare provider, be on the lookout for people who recently traveled from China or another affected area and who have symptoms associated with COVID-19, and people who have been in close contact with someone with COVID-19 or patients with pneumonia of unknown cause. Consult the most recent definition of patients under investigation. If you're a healthcare provider or a public health responder caring for a COVID-19 patient, please take care of yourself and follow recommended infection control procedure. If you are close contact of someone with COVID-19 and develop symptoms of COVID-19, call your healthcare provider and tell them about your health symptoms and your exposure. If you are a resident in a community where there is ongoing spread of COVID-19 and you develop COVID-19 symptoms, call your healthcare provider and tell them about your symptoms. For people who are ill with COVID-19 but are not sick enough to be hospitalized, please follow CDC guidance on how to reduce the risk of spreading your illness to others. People who are mildly ill with COVID-19 are able to isolate at home during their illness. If you have been in China or another affected area or have been exposed to someone sick with COVID-19 in the last 14 days, you will face some limitations on your movement and activity. Please follow instruction during this time. Your cooperation is integral to the ongoing public health response to try to slow spread of this virus. Excuse me, my reflux. I'm gonna lose my voice soon, so I will stop reading. Okay, that is our update for the COVID virus as of today, updated March 6, 2020 from Coronavirus Diseases COVID-19 Center for Disease CDC Center for Disease Control and Prevention. 24/7, saving lives, protecting people. Okay, thank you guys for watching. And please, please, please be careful. Take care of yourself. Hygiene, clean, wash your hands. Don't touch your eyes, your mouth, and your nose. And be clean. Don't be like someone that just dive in and sit, don't even care. And one thing, if there is a saliva, if there's a person who cough or sneeze very close to the metal objects, the disease or this bacteria or virus will stay live 12 hours in a metal. So washing your hands is going to help you better. So if possible, if you see metal areas, those are the places where this virus can live for 12 hours. So when you touch those, to make sure you wash your hands. And in any other places, still wash your hands. But they live long 12 hours in a metal, okay, metal surface, 12 hours. So be careful guys. To prevent of spreading, all you have to do is to be cleaned. That's what you have to do. Clean. Always wash your hands. And clean up your area when you have a workstation. Come on. If your company will provide you alcohol, so what the heck? Why not use it? Use it to clean your area so that you don't get sick. Don't be so lazy like some other people even eat their own dirt. So try not to be dirty. Okay? So in order to help, and another, money. Okay, money transfer from one hand to another. That is 100% sure one source of why this coronavirus spread. Why people say, oh, they never have a contact? Sure they do. Why? If you hold money, then you may have a contact of a person who first hold it with coronavirus. So don't be so that dumb. Money can be also a reason why this virus spread, because people sometimes touch and hold money and then they just put it in their pocket without even washing their hands. They don't even wear gloves. And then what you think some other people do? They never wash their hands, and then if they sneeze, they use their hands back. While they're touching the money, they use their hands to their mouth or whatever. So guys, if the person are that dirty, they never wash their hands, they don't sanitize, and they hold the money and they just don't care, then why wonder where this disease is coming from and how they spread without even contact? Money is one of the reason. And I'm not one of the stupid that would say causing panic. No, it's not. Because if you are smart enough, you know money is the dirtiest thing in the world. Why? A lot of people touches it transfer from one hand to another. People who had AIDS, who had tuberculosis, who had pneumonia, any kind of contagious diseases, or any kind of healthy or clean hands that pass. Money is the dirtiest thing in the world. That's why me growing up, my dad never let me touch money. I am only touching money when I'm old enough, and I need to be very careful every time I touch money. My dad always want me to wash my hands. And we are not allowed to touch money. We have helper to hold it, and if we need the money, the helper will give it to the person what we need to buy. We are not allowed. Why? My dad always said, money is the dirtiest thing in the world. Okay? So, be careful. When you touch the money, you put it in your wallet. You know alcohol? They are going to dry up so easy. So you can spray in your hands of alcohol, or you bring sanitizer. Sanitize yourself. Every time you touch money, sanitize yourself. Because money sometimes, really, a lot of people touch it from one person to another. So you said, oh, I didn't get contact with it. Yeah, you do. Because you touch money. Sometimes the money come from those people. And you never know. Maybe some people purposely spit on it. So you could get the virus yourself. So be very clean. Wash your hands, wash your hands, wash your hands. Sanitize yourself, sanitize yourself. Okay? Thank you guys for watching.
Thank you guys for watching. I hope you like my video. Don't forget to subscribe and hit the notification button to keep you posted. Make sure to like and share my video. I love you guys. God bless you always. Thank you so much. God bless.